Hi there, my name is Zoran Petrovski and I'd like to welcome you today to my Pecha Kucha presentation, Working in Partnership, the key to successful self-management. Student number 176-59387, subject code HLT3CCS. Hope you enjoy. The Department of Health describes self-management as an important approach to supporting patients with complex conditions, considered effective in both the prevention, ongoing treatment, and management of a wide range of chronic diseases. Self-management involves empowering the individual so that they can be at the center of their condition and not be dependent on support networks, particularly health professionals. Self-management is considered by many to be a facet of the patient-centered approach, a concept to healthcare provision in which the planning, delivery, and evaluation of healthcare interventions are built off mutually beneficial partnerships among healthcare providers, patients, and families. The importance of these partnerships will be further explored later on in the presentation. Almost two-thirds of patients, approximately 65%, during the period of 2007 to 8, indicated that their GPs or other healthcare professionals discussed with them better ways of managing their health, reminiscent of self-management programs, showing its prominence in healthcare treatment plans. Self-management programs aim to empower and motivate people to better manage their health by supplying information and teaching skills and techniques which can be used in the comfort of their own environments. The ultimate goal of this is to empower self-care and doctor-patient interaction, as a strengthened relationship improves feelings of comfort and ease in seeking services from their local physician. For the year of 2007 to 8, healthcare professionals overall reported that they had included self-management approaches to patient care as part of consultations, with some healthcare professionals choosing to provide patients with specific and individualized self-management programs. Putting statistics and figures aside, self-management is important because it allows an individual to take onus and responsibility for their health and well-being, reducing the burden on healthcare facilities and healthcare professionals alike. Wonderfully, self-management efforts have been shown to correlate with patterns of improved health and well-being, indicating its importance. Also, reports show that some patients have reduced their financial expenditure associated with the seeking of healthcare interventions once they adopted a self-management program. Self-management strategies are based on engaging the patient in decision-making and management of their illness, including setting appropriate goals, using evidence-based planned care, improving patient self-management support with examples including building a multidisciplinary relationships between other health professionals, as well as community resources and groups, and a team-based approach to managing care. The concept and functionality of self-management as a healthcare tool is boosted by its versatility, as it helps broaden an individual's skill set and knowledge, which in turn assists with management of their respective conditions and eases the burden on healthcare resources, as stated earlier. Efforts to undertake self-management programs can often be obstructed and impacted upon by barriers. Barriers often discourage and influence on the extent to which an individual seeks healthcare intervention, in addition to the extent to which they undertake a given self-management program. Some examples include poor support networks, stigmatization, physical limitations, inappropriate health professionals, ethically and professionally, financial limitations, poor knowledge, lack of motivation or unwillingness to undertake a given program, compounding effects of medication, and living arrangements. To support self-management, health professionals play a great role not only in treatment but also guidance when trying to counteract the effect of the aforementioned barriers and keeping the given individual motivated. This can include making office system changes, providing self-management education, and linking the patient to community self-management programs and support resources. The utilization of federal government and community resources can play a large role in reducing the impact caused by these barriers. A visit to your local Centrelink and/or Medicare Centre may prove to be a worthy trip, as the Australian government supplies funding to these organisations to assist and ease financial strain on Australian families dealing with health issues and so on. In addition, another resource you can access is Community Health Centre, who they my opinion, prove to be a useful resource as they provide universal access to services as well as targeted services for vulnerable population groups, and they're funded by the Commonwealth, so you won't have to fork out any fees. Some of the services they offer can range from health promotion, counselling, allied health to nursing services. So get onto them if you need any extra assistance, and I'm sure they'll be able to help. Albeit the term self may suggest that the individual manages their condition on their own. This is far from the truth for most, if not all, self-management programs. Self-management programs are centered on key partnerships between the individual at the center of the program, carers, family, and healthcare professionals. These partnerships help ensure that each party is up to date with the given self-management program timeline, with family and carers typically being the first point of call when the individual requires assistance. Multidisciplinary team members participate heavily in the development of a self-management program and follow progress via regular checkups with the individual and carer/families if required. Interestingly, although family members and friends may be considered as a support network when developing a self-management program, in many cases this is quite the opposite. Unintentionally, friends and family can play a role in producing stigma and judgment, and therefore discourage the individual at the center of the given intervention from sticking to their self-management program. This is where the role of a health professional stands out. Even if the respective health professional is unable to identify the potential stigmatization, they should still be conducting efforts to ensure that it doesn't arise. These efforts can be in the form of education, building knowledge, and also including them in the development of the self-management plan. Ensuring healthy partnerships between each party and not just via the patient at the center of the self-management plan will help quell any such issues. In addition, these partnerships will help identify whether a given plan is working and effective or whether it needs to be adjusted accordingly to better suit the patient. I'd just like to say thanks for listening. You've been a great audience. My details are down below, so if you'd like to contact me and ask me any questions based on this presentation, feel free to do so and I'll respond as quick as possible. And if you'd like to give me any feedback or any tips on how I can improve this for future presentations, please feel free to do so. Thanks, guys.